for us as dentists, probably the more difficult things to handle are people with a dry mouth. Dry mouth tends to be the most difficult thing for us to overcome. It often comes because of medications. A lot of the anti-anxiety medications, antidepressant medications, some of the heart medications. There's lists of medications. There might be as long as 1,000 things that will tend to give you a dry mouth. Your teeth repair themselves by saliva. They're soaking in saliva that's loaded with minerals. These minerals go back into your teeth. You eat foods with a little acid and the minerals come back out of your teeth. You don't eat food in between and your mouth's sitting in saliva that's just loaded with minerals, and the minerals go right back into your teeth. So your teeth absorb and give off minerals like the tide moves in and out. And as long as it's moving the same in and out all the time, you can be 90 years old with nice, big, hard teeth, maybe a little darker than they were when you were 18, but they're nice, hard teeth. If you have a dry mouth, you're not soaking those teeth in all those minerals like you were. Those minerals are also what causes your plaque to turn into the calculus and tartar that the hygienist is scraping off your teeth. So that's where the minerals go when they're not being helpful. The rest of the time they're going back into the teeth. So we notice problems with people with dry mouth a lot of times from medications. We can't see those problems just by looking at them. A lot of times they show up about 3 years after the dry mouth starts. So if they started a medication 3 years ago, they come in for a cleaning and you might find a cavity. Yeah, you get a little suspicious because most of our patients don't tend to get a lot of cavities. From age 25 to 75, for 50 years or so, they're just getting replacements of old dental work done. Because it's leaked, it's failed over time, just like a roof will leak or fail or wear out. They don't get new cavities. But if they start getting new cavities in new places, then you start to get suspicious. And it could be that they're into sugar or acidic things, but you ask them if they get a dry mouth. The dry mouth tends to be the biggest overall problem because you don't have a real fix for it. You just need to make people aware of it. With a dry mouth, they probably lose 70% of their saliva before they're even aware that they have a problem. So they have to be pretty bad off before they'll tell you, yeah, I got a dry mouth. So 3 years goes by and you pick up a cavity. If nothing is said, they'll come back at the next cleaning 6 months later and they got 3 cavities. If you don't catch on, they come back the next cleaning and they got a mouthful of cavities. And it varies, over time, but on average, the problem usually shows up about 3 years. So you got a lead time to do something with that because your teeth are losing more than you're replenishing during those 3 years. If you can get them on fluorides or other little tricks of the trade, then you can solve that problem, or you can at least manage the problem. You can't cure that one. That's a tough one to cure. Yeah, don't get dry mouth. You'll have a problem. I'd rather deal with somebody that has sugar cavities or acid cavities because you just tell them, do this or don't do that, and you solve the problem. And they're more logical things. If you're, they know that they're drinking Coke and they know they're drinking Mountain Dew or Red Bull or whatever. They kind of know that. The diet popsicles, that's the diet products are the trickier ones because they don't figure I can't get cavities because I'm not eating any sugar. They don't realize the acid is what's causing the cavities. If you have a dry mouth, you can't make any mistakes. You have to do everything that you possibly can just to break even. If you're into the sugars or the acids, your teeth are gonna decay, and there's nobody that's gonna stop it, even if they give you all the tricks of the trade. You gotta keep your heart running. You gotta take your medications when you need to. Sometimes you might need to adjust them, or at least mention to your doctor that some of these medications are giving you an extreme dry mouth. And if you do, mention it to the dentist, because a lot of times you need to do something about it, because if you don't, you'll end up starting to get trouble And a lot of times it's throughout the whole mouth, and you need a lot of things replaced or fixed, and it can be real costly. It's a difficult thing to manage.